So look, I'm the chair for this session, and the session's on use of 2013 census data. My name's Mike Berry. My current title is User Needs Consultant for the Census. So I work on the 2013 census, but also am working on the next census. So it's a timely discussion about use of data and challenges going forward. We've already heard lots about census data in the plenaries and the importance of it, so it's great to be able to bring some users of census data in from a variety of different user groups. So without further ado, I'd like to introduce Alison Reid. So a couple of things to note about Alison, as well as being senior researcher in Auckland Council. We've had a very long established relationship with Alison in a number of different positions back when she was part of Auckland Regional Council. And also she is the president of PANZ, and we should point out that it is the Population Association of New Zealand. I should not use acronyms. 40-year birthday, so happy birthday to us. Both Alison and I are in the PANZ committee. So welcome Alison up. She's going to talk about the vital importance of census to Auckland. Thank you, Alison.
Hello, good afternoon everybody. It's my pleasure to be here today. Thanks to you all for coming along to have a quick listen to the next 10 minutes. I do feel in part that I am probably talking to the converted a wee bit. However, I'm going to talk today a little bit about just a bit of a reflection again to remind ourselves just around the census, on its uniqueness and its fundamental importance with regard to the work that we do, building on a bit on what Grant talked about earlier this morning. Quickly introduce myself and my role in all of this. I am a senior social researcher in the Research, Investigations and Monitoring Unit at Auckland Council. We are a little bit of a unique body within local government in that we're a 50-strong research unit based in the council across environment, land use, transport, economic, social, demographic. We're a very interdisciplinary unit. We love our jobs. we think we're really blessed actually, but it's a busy space just creating the evidence or supporting that evidence to the rest of the organisation. What else did I want to say? Yes, so clearly we're key users of census data. Absolutely, we use it every single day. We were using the 06 census data up to the last minute before the 2013 census was released, even though we didn't want to. We kind of felt we had to because the demand from within our own organisation was so strong. In an environment, when you're working in an environment such as Auckland, with its size and its scale and communities and politics, and the scale of the decisions that need to be made, in that complex environment of constant growth that just doesn't stop, census is absolutely fundamental to what we do. One moment, please. So just to reiterate from our point of view, and again, I am preaching to the converted, but let's enjoy that. So census, let's just reflect on the uniqueness of the census data to us, and we've put this in writing to Statistics New Zealand quite a few times in the recent years with all the comings and goings and reviewing of possible alternatives and reviewing of timeframes. But just to be very clear to us, that at the moment there is no alternative. It's unique in that it is that 1 in 5 year snapshot that provides that comprehensive information on such a broad range of demographic data, but also around, for us, housing and transport and socioeconomic issues. It's the breadth of the information that we find really useful. What was my notes telling me to say there? Yeah, as Grant pointed out today, but I'll say it again, we have, at council, we have certainly the governing body, 21 local boards, some of which is probably as big as independent councils out there, and can be probably just as demanding in terms of their demands for information. 7 council-controlled organisations operating in a dynamic and complex environment that's characterised by significant growth and change, managing an asset portfolio worth over $30 billion and an annual budget of around $2.5 billion. that ongoing population growth creates really high demands on our ability to understand what's happening, and then have the appropriate responses around housing and transport in particular, but also community-based programs at the macro level and at the micro level. This is where the uniqueness of Census comes into us. There's nothing else at the moment that provides such robust and detailed data at the small-scale spatial level, meaning mesh blocks that we can then aggregate up, or census area units, so we can not only look at the macro picture, but certainly local communities, local neighbourhoods, areas of interest. We do a lot of mapping. I'm going to show you at the end of this a website that we've come up with. That is, we deliberately chose a mapping website. Also, there's nothing else that provides such detail and robust data at specific population group level. So whether it's by age groups or ethnic groups, we keep banging on about, but Auckland's ethnic diversity is exploded in the last 20 years. There's over 150 ethnicities recorded. It's dynamic and it's changing at different neighbourhood levels. That has a direct flow onto the ability to respond in terms of library services, community funding, our own communications as a large organisation in terms of languages and also, just it goes on and on. And also just the fact that it is a longitudinal data set, so it's those three combined. It's an absolutely fundamental tool for us. The central and key use, when I think about it, when the first data got released on 15th of October, same day as some other big news about Auckland broke, which is very interesting to be in the room with the media as that was breaking, and they all made their apologies, and you should have seen the look on their faces. Yes. Anyway, we won't go there. But the point before that, the interesting thing to everybody, mostly our Chief Planning Officer and our financial team and the media, was the good old-fashioned head count, just the numbers of people and the rate of growth and change, because that flows into the financial planning and budget allocation, and of course underpins the population projections. For us, it is always, and it probably is for a lot of you as well, a constant and ongoing challenge to manage the difference in people's understandings between a census count and a projected population. How come this isn't the same as what you said it would be in the Auckland plan? Where's the million people? Where, blah, blah, blah. So that's I guess for Auckland Council, if I'm really honest, that would be the key and central, really important stuff. If you took away a census, that would affect that. That's what all the big decisions want. But of course, all those multiple other uses it has, as I said before, we use it every day. For example, making sure our services are appropriate, they're targeted, they're marketed properly, they're accessible. I'm talking around libraries, events, parks, customer focus. For us as a research unit, our survey sampling, that's a whole other topic, but in terms of knowing who we're sampling and where they live and how to get hold of them and the numbers of language speakers. Also allocation of resources, so that's your funds and your OPEX and CAPEX. I've got 2 minutes. Right, I better move on. Planning for the future, monitoring our well-being, and also knowing who we are, just celebrating and knowing who we are. I'll have to skip over a few things. I was going to reiterate that. The main point about that, if it ain't broke, don't fix it, really was the 5-yearly cycle. It's our fixed position, actually. Just keep it we'd love to see it being just kept at a 5-year cycle. The reason for that is moving out to 10 years means a sort of 12-year delay in terms of the ability to feed some of that population information into financial planning. Things move and change, I would argue, too fast in Auckland to warrant a 10-year cycle unless there's a real alternative. I want to just quickly promo our new little website. I've just got 2 slides. www.censusauckland.co.nz. It's new. We're adding data to it all the time. I'm in a room with friends. We did use profile IDs. I don't know if any of you know about Profile ID, who came along and had a website for a while. We used that for a while. We had some problems around the price tag and the fact that it was proprietary and we couldn't actually upload the data ourselves. So we have done this ourselves. It's based on Stat Planet. It's an interactive mapping site. You can build your own queries. You can download maps. You can download data. At the moment, it's by local board view or census area unit view only. Our team within REMU are actually responsible, and Hayden Hitchens and Brian Osborne are actually adding data in all the time. It's not as smooth and polished as some other websites. It doesn't have narrative, it just has the data. And so far it's proving quite popular. But it comes up with something like this. This is an example of travel to work data. That's what that other slide was with all the cars. Travel to work data, I was going to really plug how important that is as part of the census outputs for our planning. But you can go any way in. So this is just showing you, someone has highlighted the Balmoral census area unit. They can quickly see at a glance where Balmoral is, how it compares to the rest of the region, and what the actual number of people who got the public bus that morning was. So it's particularly good if you just want to explore the data or quickly get some stats. You can customise it, you can change that scale up and down there to suit yourself. Down here's some more keys around downloading the information, taking a snapshot of the map for your presentation. Yeah, and up the top here is what we have on there so far. It's being added to, and they're clapping, so I'd better finish. Yeah. That felt very rushed, sort of little bits and pieces about the census, but I'm happy to answer any questions later. Thank you.
Timely introduction for Jeremy Robertson, Chief Advisor at the Families Commission. It's great to have you here today, Jeremy. Just a note we've got some census people in the audience, and one of the things that certainly came through from us following 2006 census was a need for more family data. We'll be looking at that in the next census. We're certainly having Claire Ward, who used to be at Statistics New Zealand and is now the CEO at the Families Commission, has certainly helped further that relationship and further our understanding of the need and use from the Families Commission for families data. So without further ado.
Thank you. Thanks, Mike. Kia ora tātou. I have very limited time, quite clearly, we all know that's the case, so I'm going to have to go through this quite quickly, but I'm happy to have further communications about any of the material here. And in fact, some of my team are here, not my team, but our team, Families Commission team, David Dundon-Smith and Corey Baker would welcome any approaches or comments for discussion. Now in this work we've also had great assistance from wellbeing, family whānau experts, and also from Statistics New Zealand, so we need to sort of acknowledge that. So moving on quickly, what's the task here? Well, the Families Commission Amendment Bill, which actually was passed last week, requires the Commission, as part of its main function of advocating for families, to prepare and publish an annual family status report on the wellbeing of families. So that's kind of the task that we've been set within that legislation. We didn't start working on it last week. We started in late 2012, and we actually published a report outlining our frameworks in 2013. It contained a number of other articles setting the context by Len, who's in the audience here today, was one of them, around importance of demographics in the family, and also by Ian Paul. So this is what it looks like. Have a read. Now, there's a couple of points to note here just quickly. Family wellbeing is not defined in the legislation, so that's something we have to work out ourselves. We are wanting to track family wellbeing over time, so we're going to need consistent and robust time series data. And we've been asked to report annually, and of course that's an issue when your data is not produced annually. I'll come back to that later when we talk about the census. Now, family and whānau wellbeing is crucially important, both for individuals and for New Zealand as a whole. We need to understand the underlying trends in terms of family and whānau structures and transitions and well-being. If we're to develop effective policies and programs, we really have to understand what's driving those changes and what the consequences are of those changes. Now, there's quite a bit of work internationally around well-being. You know, there's the move towards having measures other than GDP of well-being, national well-being, and so we have, you know, the Office of National Statistics, we have the OECD doing quite a bit of work in its Better Life initiative, and I won't list them all, but I'm sure if you went to Google you'd find a lot came up. In the whānau space, we're sort of building on a 25, 30-year history of work around whānau wellbeing. And of course in New Zealand we have the social report, and that focuses on individual wellbeing, and that's been really useful. Also there was work that Forced funded, that Auckland did an analysis of the census. I think that was referred to in an earlier session. So that was the Family, Whānau and Wellbeing Project. And there's a variety of other work that we're kind of looked at and we're wanting to build upon. So when you look at that work, there's general steps, common steps that people take. Obviously defining our terms, what do we mean by family and whānau wellbeing, developing that into a conceptual framework, and then using that framework to identify domains, possible data sources, and then measures or indicators. Now, our legislation has a very all-encompassing definition of family. Trying to define family is really problematic. And really, in a practical sense, we're going to be stuck with what is provided by the data sources. So Census has household classifications, it has family classifications, and we want to use those to unpack, you know, whether there are differences across different family types or household types. In terms of well-being, I'm a sort of psychologist by training. There's a whole long history of research around subjective well-being and the factors that influence subjective well-being, but it's very much at an individual level. So, you know, what influences the well-being of this individual? Family is a whole different level. It's a collective concept. How do you measure well-being in that collective sense? But there's also, you know, the school of work that measures well-being in an objective sense. So issues around the possession of human and social capital. So a lot of the economics literature as well have looked at well-being. Our 2013 report discusses the definitions of whānau and whānau well-being, and the key issues there really are around looking at definitions of well-being from a Māori worldview, because quite clearly well-being does differ culturally, and it's really important to capture that. Now I'm going to skip this next slide, but it was just a quick Google. What did Google tell us about family wellbeing? You can see some common themes there. Quite clearly a group of adults and children, maybe multiple generations, having fun, support, etc. Well, we got an experts group together, people that we regarded as experts and those that have done a lot of research in this area, plus some representation from Statistics New Zealand, and we wanted to do something different. You know, what is it about family? How can we frame this report in a way that keeps that focus on family? So that group advised us really to look at functioning, family functioning. How well are families doing in the things that are unique to what families do, and how well are we supporting them to do that? So that's our approach, and this is our framework to date. It's really simplified, but again I'll have to move on quickly here. We have, in a sense, a subjective sense of family well-being, how families and individuals within families regard their family, which is very strongly influenced clearly by how well that family is functioning. You can see there some of the core functions that families do to promote social and human capital, to manage resources and support, to provide a sense of identity, a sense of belonging, and of course the nurturance, care, socialisation. And then the factors that impact on families in carrying out those functions. So physical health and safety, support of family relationships, economic security, and outside social connections. And then, you know, the whole context around that, which are the broad demographic, environmental, cultural, social and economic changes. And really those functions speak to why are families important? Why is it important for us to look at families? In terms of the whānau framework that's being developed, now I'm sorry about this slide, I don't know how easy it is to read it. I tried to play around with it, but I was just messing it up. And I do have copies of it, if you'd like to have a look at those later. But this was, again, developed using a whānau experts group. It built upon Statistics New Zealand Māori Statistics Framework, which was presented to a UN Forum on Indigenous Wellbeing in 2006. It built on some of Families Commission work, and it's taking a capabilities approach, which is one of the approaches that has been adopted in this area. So looking at measuring progress towards whānau rangatiratanga. And you can see there that basically on the left we have the domains, sustainability of te ao Māori, social capability of whānau, human resource potential and economic self-determination, and going across the top, the principles of whānau rangatiratanga, so whakapapa. Some of these that we've heard already in the presentations that have been given, manaakitanga, wairuatanga, I won't go into it, I don't have time, but we've got these two frameworks which we are developing and which we are, we're interested in having people's feedback on them. But having got these frameworks, the next thing we need to do is kind of populate them. Where's the data? Yep, 2 minutes, which is good because that's, I think, where I'm at. So we come to the census. So how useful is the census for us in this piece of work? So what are the positive aspects of the census? We have a long time series. We have good official information about New Zealand's entire population. We can disaggregate, and again, this is a common theme that's coming up regarding the census. It's, we can look at it geographically, we can look at it at a household and family level, and there's a lot of value in being able to do that. We have measures on all household members, and as I mentioned earlier, the forced work that was done at Auckland looked at putting together individual responses to create family level measures, and it's statistically sound, internationally comparable, and it provides that demographic background and trends. And in the first report, 2013 report, that census data was drawn on extensively. But of course, it was 2006 data, so this is one of the questions for this session. It wasn't a huge problem, but I think for all of us presenting 2006 data in 2013 was a bit problematic, really. Particularly when other data you're drawing on is more up to date. So we're really looking forward to using 2013 data as soon as we can get our hands on it. But there are some issues, and this process, the work that we're doing here, is bringing up a number of issues around family statistics, and Mike's already indicated that there needs to be more thinking around this. So census is every 5 years, and we've got to report annually. So we're going to have to draw on other data sources. I've mentioned the problem of the break in the time series. We need more information on family transitions, and there's been talk of linking census data sets so we can get some sense of transition. Coding of family types is one I've certainly been going on about for a while, since my interest is in step families. We don't have anything on step families. And also the issue of families crossing households. So, for a fair number of children, they're living in more than one household, and of course multiple families. And then around some of the whānau work, there's a number of issues that are coming out there, and Kahukori could certainly talk about that. If a child is Māori, is living in a sole parent household with a non-Māori mother, how do they get classified? How are they counted? And then we need measures of family functioning, and we have some education, employment, etc. within the census, but it'd be good to get some other measures in there. And I think I'm probably on time, but anyway, there's the cover of our 2013 report. There's my email. Very happy, as I said, to have further contact and discussions regarding this work. Thank you.
I'd like to introduce Zoe Haws. Look, something I love about Census is the fact that what we do is really important and it has some real operational value. There's no better example, I think, in the last 20 years of looking at a particular policy that the government puts in place In this case, it's around reduction of smoking, looking at the variety of different policies that a variety of different agencies take up and promote along the lines of things like messaging on cigarette packets, smoke-free workplaces, smoke-free bars, a huge communication campaign, the provision of services like Quitline, huge variety of different approaches to that policy that was set. And the cool thing about Census is that we measure that, and in the case of this presentation and the talk that Zoe will give, will be about seeing some reduction in the smoking rates in New Zealand. So what better way to celebrate the use of census data and something that's really positive as that. So I'll hand over to Zoe. Zoe is a research analyst for Quitline, has previously worked at Statistics New Zealand, where she gets her rigour and her accuracy. So.
Thanks, Mike. Tēnā koutou katoa, ko Zoe Haws ahau. He kaimahi au mō te rōpu me motu. Ngā mihi kia koutou katoa. Good afternoon, my name is Zoe Haws and I'm the sole research analyst at Quitline. Previously I was in the Graduate Leadership Development Program at Statistics New Zealand, and I wouldn't be where I am today if I hadn't had that amazing experience. Today I'll be talking about the importance of the smoking prevalence data from the 2013 census to the tobacco control sector, and the New Zealand Government's goal of achieving a smoke-free Aotearoa by 2025. Today we've heard about a lot of really high-level uses and the importance of official statistics, especially census data, and I'd really like to emphasise why having accurate, up-to-date data on smoking behaviour is so vital. Smoking is a leading preventable cause of death. We used to say the leading preventable cause of death, but obesity is fast catching up. And tobacco use is responsible for 5,000 deaths in New Zealand annually. 350 of those are from exposure to second-hand smoke. Half of the people who smoke today and continue to do so will die from smoking, and half of them will be in middle age at a time when they have families. So this is an enormous cost to society and whānau. Smoking behaviour and related harm is highly heterogeneous across societal groups. High prevalence is seen in those with low income, who can least afford the addiction, and in Māori and Pacific peoples. An area that I've just started looking into is the prevalence of smoking in people who experience mental illness. People who experience severe mental illness are likely to die 25 years younger than their counterparts due to smoking behaviour because of the high smoking prevalence in these groups. So who are we? Quitline is a national smoking cessation provider. We support people to quit smoking through telephone counselling, web and text-based services. We support 9% of the smoking population, so that's over 42,000 clients each year. This is fantastic by international standards. 22% of quit attempts are from Māori and 6% are from Pacific peoples. Annual client satisfaction surveys demonstrate high satisfaction with our service, and 24.2% of clients are quit at 6 months. Again, internationally, these are fantastic results. So let's look at some of the high-level 2013 census data on smoking prevalence. So here we have regular smokers, ex-smokers and never smokers. The 2006 data in blue and 2013 data in green, and prevalence is on the y-axis there. So the release of these data was a watershed moment for us in the tobacco control sector. Over a period of 7 years since the last census, not accounting for population growth, there are nearly 135,000 fewer smokers. So overall population prevalence dropped from 20.7% to 15.1% over the 7 years. So in this graph we have the high-level ethnic groups along the x-axis, and the y-axis again is prevalence. 2006 again in blue and 2013 data in green. While there's still severe ethnic disparities in smoking prevalence, rates for Māori are double those of European. encouragingly, smoking rates have fallen across all groups, which is just fantastic. And I apologise, there aren't confidence intervals or error bars or p-values in any of my graphs. My comms team make pretty graphs. So again, we have prevalence. So this is showing smoking prevalence by DHB, prevalence along the axis here, and the different DHBs listed down here. Total New Zealand smoking prevalence rate 15.1 is highlighted in blue. So there are some large geographic disparities in smoking prevalence, with lower rates seen in urban areas and highest rates in low socioeconomic rural areas. There's also been some real shifts in the age distribution of smokers. So on the graph on the left here, we have age distribution for 2006, and on the right, 2013. This is total number of regular smokers in blue and ex-smokers in green. And one of the most encouraging results from the 2013 census was the halving in smokers aged 15 to 19 years old. So as Mike talked about, that is showing that all the initiatives working against uptake are really having an impact. So now I'd like to tell you a little bit about our story, about how we accessed and utilised the data. Prior to the release of the 2013 census data, we were working to targets based on 2006 prevalence levels, so again with 135,000 more smokers than exist now. So these new data provide essential calibration to not only our organisation but the wider sector. We now know how we're tracking towards the goal of 2025, how reliable other intercensal data sources are, such as the Health Survey, and to some degree how effective various tobacco control initiatives have been in reducing smoking prevalence. Quitline, for example, uses the understanding of the smoking population to contextualise our performance and provide targeted marketing to encourage smokers to quit with our support. So I made early bird data requests for smoking behaviour by age, sex, ethnicity, DHB, regional council and household telecommunications access. And I'd really like to acknowledge the fantastic work that Stats did to provide us with those data so quickly. And I had to go back several times and bug the analysts and with further requests and adjustments, and they were super helpful. Even had to go to Gareth when the Minister's office got involved, and the whole process was great. So we offered to share the data that we requested across the tobacco control sector, and the response has just been phenomenal. I've shared the data with over 50 individuals from various universities, DHBs, councils, NGOs, the Ministry and the Minister's office. So these data are being heavily utilised across the sector to better help understand and combat smoking around the country. The take-home message I'd really like to impart here is that the inclusion of the smoking behaviour question in census saves lives. We need accurate, comprehensive data to track progress towards the government goal of achieving smoke-free Aotearoa by 2025. Census provides this and allows deeper understanding of the current smoker population. Effective utilisation of these data by organisations such as Quitline reduces the societal harm and mortality caused by smoking. Thank you.